Hi everyone, I'm here to present my chart on vulnerable populations. And I have done a chart with vulnerability, and I have listed 6 different of the vulnerable populations. And I will go through each one of them and explain a little bit about my chart. First of all, just to give the definition of what vulnerability is from Stanhope and Lancaster, it is the interaction of internal and external forces that cause a person to be susceptible to poor health. So it's those things that could be something outside of the person, circumstances that are going to cause them to be sicker, have more chronic illnesses, more depression, and things like that. So let me get started on my chart. At the top is just the main topic, of course, is the vulnerability. The first subtopic of the vulnerable populations is those who are victims of rape and domestic violence. So I gave an example from our book where Stanhope and Lancaster report that 1 in 5 Black or white women have been raped and 1 in 7 Hispanic women have been raped. This leads to physical injuries, emotional injuries, and it leaves them, the victims, vulnerable to panic attacks, insomnia, and depression. So for those people who are in an intimate partner violent situation or domestic abuse, it becomes a vicious cycle of anger, fear, and violence. And if the victim chooses to leave her partner, she's more likely to experience poverty and homelessness in the process. So I put an arrow down here, but I also have an arrow going from homelessness, from poverty, and just to show the difference between, or the relationship between how one affects the other. So I'm going to move on to poverty. And those living in poverty are especially vulnerable to health-related crises. They're typically faced with barriers to healthcare, and they have more significant health problems. And that comes from Stanhope and Lancaster as well. So they might not have the resources, the means, the money available to them to be able to get to the doctor and to be able to be adherent to a health plan that would keep them healthy. I also have an arrow coming from poverty over to homelessness to show the interrelation between the two. So I will talk a little bit about homelessness. The homeless population faces many barriers to healthcare. The most often they seek care at an emergency facility. So it might be okay for an acute problem that they're having, but it's not the best choice for them for long-term management of a chronic illness or, say, an infection. For the homeless population, finding the money and resources, basic resources, such as, fresh water and soap, if they have wounds that need to be cleansed, every day. Do they even have access to water, running water, and the resources for them? Also, getting a homeless person to adhere to a medication regimen is very difficult. If you don't know where you're sleeping at night, if you don't know where your next meal is coming from, sometimes the last thing on your mind is my medication. And how are they going to pay for their medication? Who's going to write them the prescription? So it all kind of goes back to the poverty, money and resources. Next, moving on is to teen pregnancy. The pregnant teen is very vulnerable for a few reasons. They're in a transition time of their life. They're not quite an adult and they're not quite a child. So they're very vulnerable to making poor choices anyways. They are also a high-risk OB patient, and more complications are possible. Their babies are more vulnerable to living in poverty, to having low birth weight and prematurity. Also, something our book touches on is pregnant teens, tend to not continue with their education, and it's very important as nurses that we encourage them and we give them resources to carry on their education so that they have the tools and the resources available to them for their own children so that the cycle doesn't continue. I also have teen pregnancy related to poverty, which I talked about for their babies as well. Moving on to rural and migrant health. Residents of rural populations are vulnerable for a few reasons. One is that they have barriers to healthcare due to lack of availability and affordable, sufficient care. So if you live out in the middle of nowhere and you're a farm worker and, it's an hour to town, you might want to put off your next doctor visit because it's not convenient for you to go. And if you don't have anywhere to go, you probably won't go. So, second, these residents have a higher exposure to pesticides and poisonous chemicals. So if they're out in the farms and they're working, with different pesticides and things like that, their exposure to those very harmful carcinogens is much, much higher than the average person. The migrant worker faces vulnerability due to lack of education, inability to afford care, and language barriers. So the migrant worker comes here to do work, to make some money, and hopefully have a better life. But if you don't know the language, you don't know the protocols, and you don't know the country, it's going to be very, very difficult for you to manage your care and manage it effectively. Lastly, I have mental illness, and I put the correlation between mental illness and homelessness because our book pointed out that there is a correlation between severe mental illness and homelessness. And about 26% of homeless adults in the United States have a serious mental illness. So it kind of goes back to when we were talking about homelessness and adherence to medication regimen, how it's very, very difficult because, if you don't know, you're the mentally ill, severe mentally ill, they need assistance in adhering to their medication regimen and getting the proper care that they need. If you are mentally ill and you're homeless, you are even more vulnerable than just having one and not both. So I hope you can see the difference between these 6 topics, but there are several subtopics that are very interrelated between the two. And some of them are interrelated even between, more than 2. So this is a very interesting topic to me, and I hope you enjoyed my presentation. Thanks.